All right, some good news, something for free. Every American family can now order 4 free at-home COVID tests from the federal government.
Yeah, because they were getting pretty pricey at some point. This is all part of a plan by the Biden administration to stem the spread of the Omicron variant. But with the surge waning in our area, it may be a little too late for this surge. But will there be another COVID surge?
Joining us this morning, public health physician and American College of Preventative Medicine fellow, Dr. Pernell. Nice to have you on Good Day New York.
Thanks. Good to be here.
So, doctor, what do we need to know about these free at-home tests? Are they accurate?
Yes, they're accurate when you use them in the right fashion. And so what I explain to people is you want to think about the rapid test as a way to answer, am I infectious right now at the moment that you take it? So they're best used when they're used in a serial fashion. So I oftentimes tell a person, if you've been isolating for 5 days, do 2 rapid tests separated by 24 hours. If you've been at a public gathering and you're returning from travel, use a rapid test, perhaps plus a PCR test to definitively say that you're not carrying virus and you're not able to spread it.
Interesting. You know, doctor, when my husband got COVID during the Christmas holiday, he had taken the test the day before he got sick. It was negative, and that night, literally, while he was sleeping, he woke up, he was completely infected. So, I mean, wouldn't you know, like, you would have something in your system to give you a heads up it was coming?
Not necessarily, right? So what the rapid tests are really good for is if you have current symptoms, right? In addition to the way that I just explained them to use to come off of isolation, if you have current symptoms, you can take a rapid test and it says, do I have enough virus? What is my viral load in my body right now to be able to spread an infection? So it's going to miss when you're at the very, very beginning stages of your infectious course. The PCR test is better at that because it has a higher sensitivity, but if your husband were to take a repeat test once he started to display symptoms, most likely it would be positive. And that's where the rapid tests are really good. And that's why the American public needs to have access to free tests, tests that can be mailed to them, not only tests that can be selected through a website, but tests that is readily available in the public, because that's how we help to control spread during the pandemic.
Certainly so, and those 4 free tests that we can get from covidtest.gov. Now, we're numbers people, Dr. Pernell, and I tweeted you earlier about how accurate are those at-home tests. Can you give us a percentage on that?
Well, you know, there were studies done on the rapid antigen test prior to this Omicron surge. And what those studies show that they were roughly in the 80 to 85% sensitivity range, right? So they would be able to pick up the proper infections, the proper amount of infections in 80 to 85% of the cases. So there is some level of you know, chance that you could be negative on a rapid test but really have the infection brewing. But that's manageable. When you use it in that repeated or serial fashion that I've described, that sensitivity can go above 90%. So that's how you want to think about it. When your prevention toolkit, you have various tools, and when used appropriately, those tools are very effective at limiting spread.
Yeah, some good advice there. What about this? We're seeing some differences in people swabbing their nose rather than swabbing their throats, and which one is more accurate. What is your stance on this?
So the rapid tests were not evaluated to see if they would be effective being used as throat swabs. Do I think that throat swabs or even swabbing the inside of your mouth or your cheek is something that we should consider for future use? Yes. Unfortunately, I don't know how effective that strategy would be during this current surge. But what we know with Omicron is that it replicates in the throat in amounts that are more significant than in the nose earlier in the viral history. So that's where you have some countries like the UK and even Canada that have been recommending the throat swabs. And you have some in the public health community that are recommending that people do both, swab your nose and swab your throat. I'm still telling people to swab their nose only because those swabs were not made to swab your nose. Your throat, there may not be long enough. People aren't sure where to quite place it, but it is something that we should keep our eye on and something that we should fully evaluate so we can have a definitive answer.
Are you concerned that these free COVID tests, you have to go online and get them? I mean, I know that my mother can't do that. She doesn't know how to do it, so I did it for her. And maybe some communities don't have access to computers.
Definitely, Rosanna. It's the same issue when we were trying to find vaccines, right? And you could go online and sign up for a coronavirus vaccine. In public health, when we are centering on equity, we want to make the prevention tool easily and readily available to the public. So we should be sending tests to people regardless of whether or not they can sign up on a website. Perhaps we should have a phone line so that older Americans or those who don't have access to Wi-Fi or access to a device would be able to say, hey, I need rapid tests. We have medical schools locally where I am that have rapid tests and vending machines so that students could go up and get a test if they think that they may have been exposed or they think they may be displaying symptoms. We need that multi-pronged approach. That's when prevention is at its best.
You're right, Dr. Chris Pernell. Thank you so much for coming on Good Day New York. We appreciate your insight.
Yeah, and for clearing a lot of stuff up. We appreciate it.
Thank you.